maintaining social distance, sanitizing commonly used surfaces, and being highly conscious of their surroundings. Those are our weapons, and they're very powerful weapons indeed. Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states. Every state is very different. They're all beautiful, we love them all, but they're very, very different. If they need to remain closed, we will allow them to do that. And if they believe it is time to reopen, we will provide them the freedom and guidance to accomplish that task, and very, very quickly, depending on what they want to do. We are also encouraging states to work together to harmonize their regional efforts. We'll have numerous cases where states have worked and will be working very, very closely together. As we reopen, we know that there will be continued hardships and challenges ahead. Our goal will be to quickly identify and address any outbreaks and put them out rapidly. If the virus returns in the fall, as some scientists think it may, possibly, these guidelines will ensure that our country is up and running so that we can likewise put it out quickly. At the heart of our strategy is the vital role of medical research, especially for therapies that will significantly improve outcomes for high-risk patients and reduce the need for urgent care. This will be tremendously valuable in allowing life to eventually return to normal. At least 35 clinical trials are already underway, including antiviral therapies, immune therapies, and blood therapies in the form of convalescent plasma. You've all heard about some of these events and some of these therapies. They've come a long way. What's been done in the last 4 weeks is incredible. We will also continue to expand our testing capacity. We have now completed more than 3.5 million tests, by far the most anywhere in the world. Areas of our country that have been hotspots have done much more testing on a per capita basis than South Korea. We've done more than South Korea, and South Korea's done a good job, but we've done more. We will continue to work with governors to advise them on how to conduct both surveillance and diagnostic testing. We have now distributed over 600,000 Abbott ID Now point of care diagnostic tests. These are tests that are done on site, and within 5 minutes you know the answer, positive or negative. In recent days, we have seen a dramatic increase in the number of tests performed by hospitals and academic institutions, with more than 120,000 tests recently reported in a single day, far more than any country in the world has ever been able to do. And our numbers are actually going up. As these new and better testing solutions come online, we're seeing this additional capacity reflected in the numbers. For this reason, the number of tests processed in commercial laboratories has dropped from approximately 100,000 to roughly 75,000 tests over the last week. The reason it dropped is because we have so many other tests and we don't even have to go through the laboratories. But the laboratories have tremendous additional capacity, and states feel free to use that capacity. Some in the media falsely reported this as a bad thing, when in fact it is a great thing, because it indicates that the states are moving to faster, more local testing solutions, including on-the-spot tests. So this drop in the utilization of commercial laboratories is an affirmation that testing, which is at an all-time high, is growing at a historic rate. In other words, the laboratories are great, but now we have forms of testing that are much quicker, much better, and we don't have to use the laboratories, but they're there, and they have a great capacity to do the work.
And there you hear the President of the United States saying he is ready to move this